And good afternoon, everybody. This is Paul speaking, first of all, and Will's going to come in as well and introduce himself from time to time. Okay. What we're going to get over for the next sort of 20 minutes or so is really a brief introduction to housing and how it relates to health. Some examples of innovations and things that we're involved in at the moment. And we also want to talk about why Bromford took an approach to introduce an innovation stream within the organisation, and hopefully there's some takeaways that you can look at as regards your own organisations as well, because innovation, overused word, but a big hot topic for all of us in fast-changing environments. So first of all, what I'm going to do is just hand over to Will to give a bit of a background to who Bromford are.
Said there, my name's Lilley, and I like to live on the edge, literally in my own life, but also professionally. And I live on the edge of Bromford. And as an individual, my role is to connect Bromford to lots of different sectors that can help us create real meaningful relationships with our customers that enable them to really reach their potential. And as you can see, our strapline there, we like to call unlocking people's potential and helping them to achieve their aspirations. There's lots that we do, and we are part of a sector, and housing, like health, is a huge a subject that I could not in any way do complete justice in sort of a neat 20-minute segment. But Bromford represents housing associations more broadly, and there's about 1,700 registered housing associations across the UK. Housing associations are so much more than just bricks and mortar, and I think as our strapline below reveals, we do so much more than just build the home. Housing is a critical foundation of well-being, of enabling people to reach their potential without a home is very challenging. But we do so much more as a sector, and as an organisation. As a sector, we invest millions every year in employment, in helping people connect to their community, and we are increasingly doing a lot to connect and link in with the health and sector. I think it's an investment and commitment that is often under-recognised, perhaps, by sectors beyond housing, and so my role is to kind of bridge and make those connections. At the heart of Bromford is that recognition that the most important asset, if you like, is the customers, is the people that live within our homes. And perhaps historically our sector has been narrowly focused on bricks and mortar. I think that's true from most commentators in our particular sector. And we have become very insulated in focusing on that kind of traditional key purpose. And it is a vital thing. We have a huge housing shortage at the moment in the UK. However, it is one element of what we now do. So our core mission statement, as I said before, is enabling people to reach their potential. And we do that through a range of different things. We particularly invested a fair bit of time and attention on understanding what are the skills, gifts and connections that our customers have beyond just their housing need. And it's something that we're beginning to do across the organisation. And the reason why we're doing that is our belief that as a sector, and I think this is true of other sectors, particularly health, is that we've tended to focus on the negative. We tend to focus on what people can't do and what makes people unwell, on illness, as opposed to what makes people well, this kind of idea of well-being. And I suppose by focusing on that in a stronger way, we can enable people to be more resilient. We can get to understand what makes people survive and thrive in their life, as opposed to what often leads them to becoming unwell. We also recognise actually we need to look at a huge transfer of power from the sort of traditional public service model of delivering services to passive recipients, recognising actually citizens are the main characters, that they're the most important thing, and actually enabling, empowering them, giving greater control over their life will enable all of our sectors to be much more sustainable. And will support a welfare state which is under significant challenge at the present moment and into the future. We've also recognised in Bromford that some of these ideas and this kind of core ambition is a big cultural change to where we have been previously in housing. but also I believe it's a cultural change across many sectors. It's a change to our attitude to the people that we serve, and it's a change in our value set as an organisation and how we operate. So I'm going to hand you back now to Paul Taylor to talk a little bit about how we're going about this stuff.
Okay, thank you. When Bromford started sort of looking at this agenda, probably going back about 4 or 5 years really, we really recognised that this was going to challenge the traditional way we'd sort of done business. As Will has said, we often looked at what people couldn't do rather than what they can do for themselves, and we're facing rising demand on our services as well, which I know absolutely chimes with the work of the NHS. So we were getting more and more contact from communities, obviously more there's greater ageing population, so there are rising longer term conditions. And what we recognised as an organisation is we couldn't do everything. We needed to work in partnerships in different ways, and we need to particularly tap into our colleagues and our partners about how they could improve things and how they could innovate. So one of the things we did just over a year ago is we established the Bromford Lab, which I lead up as innovation coach across the organisation. And I think, first of all, when we talk about innovation very quickly, we should accept that it covers quite a range of activity, and sometimes the word innovation itself is overused, as I said earlier. And I think it goes on this scale of, doing things a lot better. So things that are beyond just incremental improvements, to doing completely new things, to the scale of making the old stuff obsolete and actually doing the more sort of radical transformative stuff. And innovation to me is not about just coming up with new products and services. It's about having a more disciplined approach to choosing what you should do and what's going to have the biggest effect on the end user and what's going to be of most value, and we'll touch upon that a little bit later. I think one of the things that we have underutilised in the past within our organisation is the use of our internal talent. People generally will often come into a role and perform their job description, and often the other skills and talents they've got go ignored, and the employer doesn't tap into it. So we wanted to have a space where actually we could explore what else people could do, and this is really important. What was out there in our communities and what talent have we got with our communities? And when I say communities, I mean people like yourselves as well, our partners, our stakeholders, and how can we merge that in such a way that they can actually help us innovate and help us conquer some of the big challenges we've got. I think we're all accepting we're going to be operating with certainly no more resources that we've had in the past, and usually a lot less. So I think the whole thing about how organisations tap into what's out there and what's in their networks is increasingly important. So we established the lab as a very limited number of colleagues. It's 4 colleagues who act as the centre point for the organisation for stimulating creativity. One of the things that started the Bromford Lab, we were in a senior leadership meeting actually, and a new director had started in the organisation and asked the question, who's responsible for nurturing bright ideas in the organisation? And we all did this sort of thing where we looked at each other and we realised we couldn't answer that question. And I think one of the things, wherever you work, however big your team is or however small your team is, it's really interesting to ask yourself the question about who's responsible for actually grabbing those things and growing them. Because one of the things that does kill innovation or can kill innovation is hierarchy itself. And we all work within hierarchy, and we have to accept that's a way of doing things. But one of the things we have to do when we're looking at growing new approaches is how we can encourage people to think beyond the hierarchy and act beyond the hierarchy. So identifying somebody in your team or your organisation who can act as that gatherer of ideas to make sure something happens with them. Most ideas in organisations sadly go nowhere. They usually stop between the person who's had them and the immediate person they've spoken to, usually their line manager. And that's not a reflection of bad line management, it's more a reflection of how we spend our time. So what the lab was established to do was to create some space for people to actually go about that. And the lab works really simply. Anybody, anywhere, externally, internally, can pitch an idea. At the initial stages, there's no such thing as a stupid idea. As we go on, you do realise that some ideas are, in fact, stupid, and we shouldn't explore all of them. But opening it up to people to actually put their ideas forward, and then we actually work with them, usually in quite a light touch way, to see whether that solves a problem for the organisation, for our colleagues, for communities, or for other people. And from there, we do some very basic work around building something up and testing it. And this is absolutely crucial to our approach, because we don't go any further with anything until we've tested it. What we've found historically across the public sector, and this is not necessarily true of health or housing, but I think it's a wider public sector issue, is often things have gone to a pilot stage which have commanded quite a lot of resources before they've actually been properly evaluated or tested. And what Bromford are trying to do is to do more tests and less pilots, because pilots can be very expensive and we've got a lot less money than we used to have. So we're trying to get into a discipline of very small scale tests before we go forward and do something. And the culture we're trying to instill is about, just because we've done a pilot doesn't mean we have to roll it out. We can release it, we can scale it, but we can absolutely shelve it or we can kill it. And there's no disgrace at all in killing something. One of the things when I pitched the Bromford Lab to our executive team was that 75% of the work we did would probably fail, and we wanted them to get that into the language, not to celebrate failure, but to understand that we wanted to create a safe place that people wouldn't make things work if they weren't really meant to work. Because we've got loads and loads of things we could be doing in health and housing. We can't do them all. So we need to concentrate on the things that have got the biggest value. To identify the things that have got the biggest value, you're going to have to test things. So we've talked here about, trust in organisations is unfortunately decreasing, and we need to develop a new language of honesty. We need to have greater places to fail. And when I say places to fail, I don't mean putting people at risk. Failure is often used in a when we talk about in a housing or particularly health and clinical context as meaning putting people at risk, and good innovation and good testing should eliminate that. I think we do need a different attitude towards risk in organisations sometimes. But when we talk about failure, it's about being safe to fail and about putting measures in place with the right governance, with the right checks, with the right facilitation to make sure we're not putting anybody at risk. One of the things we are doing that you might find interesting, and I think I'm really passionate about this in terms of my social media profile and what I want us to do, is all our work is being published in public. If you go to bromfordlab.com, you can actually link through to the current things we're working on, and we publish as much as possible without obviously breaching any sort of data protection. So it's there for everybody to see. That's for people inside the organisation and outside the organisation, because we're really fans of this thing of like working out loud in public and allowing people to see what you can do. Because for us, the more trust we can build up with our communities, the better, the more we can get them engaged in this process and engaged in putting forward their ideas as well, is really important. We don't want to have silos for colleagues and silos for customers. So that's a relatively new sort of progression for us, but it's something that we think is interesting. In terms of things that I think all of us can do in our organisations for boosting innovation, I think, as I said earlier, first of all, it's about identifying who's responsible for nurturing bright ideas. And if you can't name that, identify that. It doesn't mean creating a role out of it for somebody. It's more about have somebody who's constantly sourcing all the various networks we've got now, or having the conversations over the water cooler and picking up things that are going on and then doing something with them. Innovation is not about doing everything, it's about solving the right problems. It is about giving people a safe space where it's okay to be absolutely crazy and to think things that we might not have thought before. Thinking crazy things does not mean that you then go and do them. We bring that back to some kind of reality. So some of the sessions we do here go really, really left field, but we always bring them back to a place where actually it's something that helps people. And I think the thing I said earlier about hierarchy is that one thing we've noticed about doing lab sessions here is get as many frontline people involved as possible. If there's too many managers in the room, it's the job of a facilitator to make sure that there's a reality check, because we often find that the people who are closest to the problem are the people who are talking to our customers, our service users, day in, day out, and make the ideas visible, as I've already referenced. Something that's, often frightens people about innovation is that a lot of people will reject it, or actually it will scare them. And one of the things we have to do within organisations now is actually accept that. People never welcome innovations. The slide there shows actually the early adopters and innovators are a very, very small part of your organisation. And that is not a barrier, actually. What you do need to do is to communicate well and take people with you. The late majority and the laggers will catch on eventually. That's what people do. Even I, as a fairly early adopter, I remember the first time I saw the iPad and I said that will never, ever catch on. So I think it's really important to remember that when you talk about change within your organisation, there'll always be resistance to it. And what's really important is identifying and building up coalitions of people who can work with you. And they might not be the people who are immediately in positions of authority or power, but what you need to identify is good rebel behaviours within your organisation, and to build that up with you. And I know this is something that Helen Bevan's talked a lot about as well. You absolutely need to avoid troublemakers within the organisation as well, but rebels who want to do things differently, who are passionate and optimists and look at possibilities, are the people who will help your ideas move forward. And finally, in terms of innovation, what I want to say is we have a unique opportunity in health and housing, in social care, in that the boundaries are coming down between us. They might still be there within our organisations, but we have blogs now, we have social media, we have comment forums. We're not as tied to our organisations as we used to be. And the more communication we can do in public, I think will break down some of the links, some of the barriers that have been there historically between some elements of the social sector. Will's going to talk now a little bit about more specifically what we're doing around innovating around housing and health.
Hi everybody. So yeah, as I mentioned earlier, we've taken stock of how we've operated as a business historically. And I think one of the things we've recognised in the lab and in this sort of new approach is that we have for too long focused on mapping the problems that we face, mapping the problems that our customers face, for very good reason to meet those needs, but in narrowly fixating on those needs, we miss the potential and capability and power that people actually have to resolve their own challenges and be in control of their own well-being. And there's a great slide here called Mapping Misery. If you just read a joint strategic needs assessment, and we're involved in the creation of many of them in lots of localities that we work in, they are maps of misery. We've got very good and very sophisticated at mapping what neighbourhoods and communities and people can't do. But then trying to move beyond that becomes very challenging, because we've sort of defined people's lifespan by the negative. So there is a huge trend across the UK at the moment, and I know a lot of this work actually resonates very much in health and public health circles, of looking at their assets and strengths and capabilities and this kind of concept of well-being and resilience. So we've taken a lot of this sort of thinking, and we've tried to identify partners within health and beyond that are also on the same journey and the sort of same path of recognition, that are very engaged in place shaping, that are engaged in kind of getting closer to communities and understanding what communities really need and what they can do. I can't cover all of the examples that we're doing, but we've probably had about 8 or 9 different types of pilots and tests using kind of the lab process. Some of these pilots started a little bit before we developed the lab, but have kind of come into the lab and have been sort of supported since. Particular one that we're really proud of is our relationship with the hospice movement. And we've been working very closely over the last 2 years with an NHS provider, but a hospice called St Giles Hospice in South East Staffordshire and Staffordshire. And about a year and a half ago, 2 years ago, we connected with them, I think through a connection within the organisation, and we started a dialogue to see, where were the sort of mutual places that we could collaborate. St Giles is a huge hospice, actually, or the main hospice and palliative care provider in an area where we have over 6,000 homes, where we probably support about 11,000 people in this one particular area where this hospice operates. So there was clear connections. We have a particular ageing population in this one particular part of the world that is going to get older, with many younger people moving out of the area. So, there were huge opportunities to collaborate. And we got into a room with commissioners included, and we started to work out a theory of change of how we could actually operate together, using kind of some of the thinking that the lab has developed. And in doing so, we created a pilot, a small test called My Home Support. Now, we'd never worked with St Giles, we'd never really worked with a clinical commissioning group, so we recognised we needed to sort of build up some trust and some understanding and learn where we can really truly make impact. And over about 12 months, we tested a housing-related type support worker, one of our colleagues, to be placed within the palliative care team of St Giles. And over 12 months saw around about 70, 78 patients where we engaged to help them achieve their aspirations. We kind of developed an idea that many people wish to spend more time at home at the end of life, but many rarely do. As a housing organisation, as a community-based organisation, we have great connections into housing. We can address that situation, and health can provide the support around care. So we saw a real great synergy. So in testing this, we created some fantastic outcomes for the small cohort of people that we worked with, enabling many to reach their aspiration, if that was the case of spending more time at home, and in the case of many. So we as an example of that, we then decided to develop a longer term relationship, which is what we're now in the process with St Giles, where we're going to have a permanent member working with them across South East Staffordshire in delivering the service. There are lots of other examples as well with this particular clinical commissioning group in South East Staffordshire. We've been working with them on a project called Winter Buddies, which supports the vulnerable, frail and socially isolated individuals that we both work with, both as housing tenants and they as patients through GPs. And we've been working with those individuals and connecting them to assets that exist beyond professional services in their community that can support them through challenging times. Going right back to that early stuff, we recognise that actually people live shorter lives when they have less social connections in their life. There's a lot of studies, the Mammoth Review, and lots of things that support that. We've been posting people in accident emergency departments to see what the wellbeing or social housing or housing determinants are that prevent people from exiting hospital more quickly, and also the issues that lead people into hospital in the first place. And we've saddled up with a number of key health stakeholders that are significant in our communities, where we have a lot of homes one particular one being in South Birmingham, where we've been working with University Hospital Birmingham, NHS Foundation Trust, and we've also been working with the major community healthcare provider in Staffordshire around a particular pilot called Return Home. The one thing I'd just really quickly mention that we're really excited about is the work that we're doing with Staffordshire County Council and the Public Health Directorate there, as well as clinical commissioning groups. We're working to look at what makes a community connected, what makes a community resilient, and how can we collaborate across the silos to reinforce and support resilient communities. What our communities are doing brilliantly that we actually as professionals are just not connected to, that are under our radar because we're fixated with needs. And in doing that, we've worked with Staffordshire County Council in commissioning, well, they're commissioning 3 pilots, again, small pilots to find out what works and what doesn't. And we're working with a range of local and national experts in looking at what makes communities connected. And I'm really excited about that particular piece of work that we're engaging and supporting. So there's loads of examples I'm sure in the question and answer session we can talk about, but hopefully that gives you some sort of insight.
I think this is a slide that we absolutely love, just in terms of start with the why of what you're doing, and I don't think sometimes it's something that housing has been traditionally good at. We have a saying within the organisation that sometimes we're guilty of initiative-itis, of having an initiative for everything. And I think increasingly now across the public sector, it's going to be about, why are we doing that? And then being really focused about being innovative and creative about how we do that. So some of the examples that Will gave, we wouldn't have actually, there are a lot of young people who turn up at A&E. So what could we do that? We engage with a lot of young people. So what could we do to help out? And some of these things is non-traditional thinking. So I think what I would say, probably to end on, is to say, always start with the why of what you're doing and go back to, what's the benefit to the end user, rather than how you do it or even what you're doing. But that's probably the last thing I'll say, and then
And one last quick comment from each of you about what do people do when they put the phone down now? What's the next thing they can do easily to make the first step towards making this change?
There is a huge outpouring of interest from our particular sector to engage in health. A couple of good websites, good places to start to learn more about housing and where housing associations are in your local community, or where housing exists in your local community, and you start just looking at what's out there.
Yeah, I think for me, it's really it's go out there. Start having conversations with people, whether that's on social media, whether it's in real life. Let's connect our sectors, because I think we've got a huge opportunity. There's huge assets. Some of the really difficult questions we've got to solve are going to be far more easily tackled if we're operating in partnership.